So hi all, today we'll learn about clavicle with our first year students. You can start.
Hi, I am Leela Lakshmi from Cardiopulmonary Perfusion Care Technology in SNS College. This is clavicle, is also known as collarbone and beauty bone. It is slender shaped and located below the neck or base of the neck. It is the only bone which represents as horizontally. Clavicle comes under the long bone. It is located between rib cage and scapula. It also connects breastbone and shoulder girdle.
Okay. So how many ends are there?
There are two ends. Medial end connect with sternum and lateral end connect with scapula.
Okay. Next we'll learn about the parts of the clavicle.
The clavicle has shaft, medial end and lateral end and costal tuberosity, trapezoid line and a conoid tubercle. The shaft is long bone and it is about 2 cm in length. It is attachment and origination of many muscles. The costal tuberosity present on the inferior surface of the clavicle. It is present on the medial end.
So in lateral end we have an acromial joint. Okay, we have two joints actually. One is called as what is this joint is about? Sternoclavicular joint, and this is about acromioclavicular joint. So your lateral end parts is attached with the shoulder blade. Okay. So what is the present on the medial surface, which is called as
Costal groove.
okay, costal groove is present on the inferior surface. What is the function of that costal groove?
Blood supply.
Okay, it has the blood supply of the clavicular part. Okay. So what is conoid tubercle?
Conoid tubercle is a rough projection present on the inferior surface. It's called the conoid tubercle.
Okay.
It has muscle attachment of corboclavicular ligament and the conoid ligament.
Okay. Corboclavicular ligament and the conoid ligament has been attached with the conoid tubercle. So what is trapezoid line?
Trapezoid line present on the inferior surface and this connects
With the trapezius ligament actually, and the trapezius muscles also will be flowing and it connects with the scapulary end. Okay, it lies laterally from the conoid tubercle into the lateral end of the clavicle. Okay, why we call this as a beauty bone is you can feel the bone fully, and this bone will say about your shape of the body. When you are become very linear and you are not obese, it says that you are a beautiful person. That is what the use of a clavicle is. Okay, what is the function of clavicle? What are the functions of clavicle?
Clavicle helps to connect arms to skeleton.
Okay, it arms to skeleton.
It helps to protect heart from external shock.
Okay, it also ribs is also protects the heart from external shock.
It helps in the movement of shoulder girdle and scapula.
Okay, it also helpful for the movement of your shoulder girdle, shoulder joint also. Okay, anything want to say about the clavicle? Okay, so clavicle has the two joints and it has two ends, which is called as medial end and lateral end, and the shaft is the biggest portion here, and the shaft has been divided as a 2/3 for the medial end and 1/3 for the lateral end. And you have a tuberosity, which is a small projection on the medial end, and you have a tubercle, which is a rough projection on the lateral end surface, and you have a trapezoid joint and acromial joint at the end. Okay. Now we are going to see about the muscle attachment of the clavicle.
sternocleidomastoid muscle.
Okay, sternocleidomastoid muscle will be connecting on the major neck support from the clavicle.
Pectoralis major muscle.
It supports the ribs, it covers the ribs.
Subclavius muscle.
Subclavius muscle will cover the upper portion of your body, the thoracic region.
Sternohyoid muscle.
It supports the hyoid bone with the clavicle.
Trapezoid muscle.
Trapezoid muscle will cover the lower end of the clavicular bone with the ribs. What are the types of ligaments that we can know?
Costoclavicular ligament.
Okay, costoclavicular ligament. From the costoclavicular, so what is the exact location of the ligament will be costal surface. So it connects with the lower end. Okay, it is called as costoclavicular ligament. The clavicle is attached to the lower end of the ribs. Okay.
Conoid ligament.
Conoid ligament, it is present near the conoid tubercle. Okay.
Coracoid ligament.
Coracoid ligament, this also comes under the part with the scapula.
Trapezoid ligament.
Trapezoid ligament is also having a muscle attachment. So trapezoid ligament is attached with the trapezoid muscle. That is what it is present on the trapezoid line. Okay, these are the various ligaments. So how many ligaments we have seen? 4 ligaments. How many muscles?
6
6 muscles. How many surfaces? 2. What is the 2 weight? Medial leg
Medial leg
and lateral leg. What are the major parts? Medial leg, shaft, and the lateral leg. Okay. So the anatomical aspects of the clavicle is you can get a clavicular fracture when you get an accident. So the clavicle can break and it causes a damage, or it causes a deformity of the shoulder. The shoulder can dislocate when there is a problem in the direct clavicle, and also there will be a ligament tear which the newborn babies will be facing higher. Why? Because when the babies have been handled by the parents, they might have handled with the humerus bone. So once they have pulled up the humerus, automatically the ligament supply of the clavicle get damaged. So the patients may have a wear and tear of the ligament supply. And also the clavicle is highly prone to disease and highly prone to an accident. Why? Because it is a protruding bone, you can able to feel it. So that is a high chance of getting a fracture of the clavicle.